Today in cannabis news, files reveal that a former anti-cannabis congressperson and a prominent health official for former President Donald Trump has joined the board of a cannabis corporation. Nebraska state medical cannabis activists unveil a revamped 2022 ballot campaign with two distinct initiatives. And cannabis purchases have risen significantly in multiple U.S. states during the coronavirus pandemic, according to a recent analysis. It's Wednesday, August 11th, and this is your Trichomes Morning Buzz.
Broadcasting live from the Trichomes.com studios in Southern California. It's time for your Morning Buzz. We bring you late-breaking news that keeps you up to date with what's happening in the cannabis industry.
First up, a member of the board of directors for a medicinal cannabis company in the state of Georgia is a former leader of the U.S. Department of Health and Human Services. Tom Price, who worked as Secretary of Health and Human Services under former President Donald Trump for 7 months until stepping down in the wake of a denunciation over spending hundreds of thousands of dollars in traveling costs, is registered as a board member of the Botanical Sciences, LLC, one of the 6 cannabis companies that received permits under Georgia's narrow medical cannabis system last month. Price's engagement in the sector is noteworthy in and of itself, as former congressperson who consistently voted against cannabis policy reform. They voted 6 times against changes to fund legislation that would merely protect state medicinal cannabis systems from federal meddling by the Department of Justice. Despite the objections, such safeguards were successfully established. They also voted thrice against budget bills that would have allowed doctors at the Department of Veterans Affairs to suggest medical cannabis to military veterans. Furthermore, as Secretary of Health and Human Services, they had the authority to start steps to publicly acknowledge cannabis's medical use and reschedule it under federal statute, which they opted not to do. Now they appear to be a part of a sector that generates billions of dollars in revenue annually.
Next up, activists in the state of Nebraska this week presented a new plan for legalizing medicinal cannabis through voter measures next year, declaring that they will aim to qualify 2 complementing proposals on the 2022 state ballot. The dual method is intended to prevent violating the state's single-issue requirement for voter measures, which prompted the state Supreme Court to disqualify a medical cannabis legalization proposal that was meant to be on the 2020 general election ballot. This session, a different attempt in the legislature faltered when backers were unable to assemble adequate votes to override a Republican filibuster. Following that, Nebraskans for Medical Marijuana announced that it was working on a number of ballot measures, as well as a very brief constitutional amendment that would clearly state that people in the state of Nebraska shall have the right to cannabis in all its forms for medical purposes. However, the organization now says it will abandon that wording in pursuit of 2 distinct statutory measures that will work in unison. One would mandate legislators to enact laws creating legal safeguards for patients and physicians when it comes to cannabis, and the other would mandate legislators to enact laws permitting private businesses to manufacture and distribute medical cannabis goods.
Last up, as per a recent analysis, legal cannabis purchases in numerous U.S. states hit record levels in 2020 as COVID-19 spread through the country. Purchases in 4 states studied, Alaska, Colorado, Oregon, and Washington, have increased more during the COVID-19 pandemic than in the previous 2 years, according to the study. A team of health analysis obtained pre-tax cannabis sale figures from state regulatory bodies and evaluated the statistics over time in this study. It discovered that despite stay-at-home directives wreaking havoc on other major industries, cannabis purchases accelerated. Findings show a general increase in cannabis sales following stay-at-home orders issued in Alaska, Colorado, Oregon, and Washington in late March 2020. In all 4 states, those increases were greater than the percent increases observed in the preceding 2 years, reads the report, which was published last week in the International Journal of Drug Policy. While the researchers didn't try to pinpoint why sales were up, they postulated that it could be due to various considerations, including rising cannabis consumption among people dealing with stress, Stay-at-home orders driving consumers away from the black market and into certified shops. Potential price hikes due to increased demand and or the purchase of more pricey cannabis items.
That was today's Buzz. Thanks for listening. For more cannabis news and insights from industry professionals and a place to discuss these stories and others, visit trichomes.com.
And be sure to catch up with all of our other cannabis industry-related podcasts like Hash It Out, Careers in Cannabis, or the International Cannabis Conversation, wherever you get your podcasts. For trichomes.com, I'm Devin Leal.
And I'm RJ Balde, signing off.